The dural infoldings, otherwise known as meningeal infoldings, are going to be positioned between the large gaps within our brain known as fissures. We are going to see a dural infolding between the right and left cerebral hemispheres, known as the falx cerebri. Falx actually means sickle, so this is a sickle-shaped large extension of dural tissue extending from the anterior aspect of our anterior cranial fossa, where it attaches at the crista galli, a ridge-like projection from the ethmoid bone. It's then going to attach to the inner aspect of the frontal bone, continue along posteriorly towards the parietal bones until it reaches the occipital bone posteriorly. In line with the falx cerebri, but positioned more inferior to it, we see the separation between the cerebellar hemispheres created by the falx cerebelli. Where the falx cerebelli meets up with the falx cerebri, we see another horizontally aligned dural extension, known as the tentorium cerebelli. The tentorium cerebelli is going to be positioned between the cerebellum inferiorly and the occipital lobe of our cerebrum superiorly. The gap within the tentorium cerebelli is known as the tentorial notch, which is going to allow for passage of the brainstem up through from the posterior cranial fossa towards the middle cranial fossa. Now, the meningeal infoldings are actually going to be created by extensions of dural tissue. And how this looks if we were to take a cross-sectional cut down through the skull, what we would see is that the cranium itself, or the skull, is going to be lined on its inner aspect by the dura mater. Now, the dura mater itself is going to line the inner aspect, and then it's going to have two layers that will separate at these points. An outermost periosteal layer that stays in contact with the skull, and an inner layer known as the meningeal layer that is going to extend on either side down into those fissures, and then create little pockets known as dural venous sinuses. These dural venous sinuses are where we're going to get the drainage of the venous blood from our brain. But the actual infolding itself is created by this infolding from the meningeal layer of the dura, and that's what we're seeing represented here in the 3D model